Welcome to our session with Dr. Munné. Today, we're diving into a question we get asked all the time. When do you know you need implants? So let's dive in with Dr. Munné in this session. Thank you.
Thank you, Adrian. Good morning, all of you that are listening to us. And I want to share with you some of the things that happen, in the dental office when patients are asking, well, do I need dental implants right now, or when do you know that you need them? And that's a very valid question, right? Because there's arguments made both ways. Like, you can try to save teeth and continue to save them, but at one point are you going to decide that, well, the tooth is already ready to be taken out? And another thing that happens very commonly is that sometimes patients feel like they're tired. They already had enough. They're already at the point that, take them all out and let's do dental implants. Is that a valid concern? And that's definitely a question that can have many different answers, right? So I think that what's important to know is, like, what are their options, right? Are there options to still save the teeth? And when a patient wants to give up, I want to ask the patient the question, well, what is the motivation behind you wanting to have all your teeth extracted? Because the motivation could be pure economical, right? Well, I'm just looking for a more affordable solution for me, because what is going to entail to save all my teeth might not be something that I can afford at this time. But dental implants are not cheap either. Sometimes you need to look at the cost effective, because there's a lot of work that goes into placing implants, and especially if we're looking at restoring multiple teeth, or maybe a whole arch, like all the uppers or all the lowers. So there's going to be a significant investment, maybe not as much as having to crown every single tooth, if that's where you're at. But we need to know definitely the motivation. Another possible motive could be, well, I'm just spending a lot of time and I just want something simpler. Well, implants are not necessarily simpler, and I want to make sure that you all understand that implants is like placing another tooth in the mouth. So a tooth requires maintenance, like everything requires maintenance, right? Your car requires maintenance, your house requires maintenance. If you play sports, that requires maintenance, right? Let's say the tennis court requires maintenance. Everything in life requires maintenance, and implants require maintenance even more than your teeth, because your teeth have some natural resources that the implants do not have. So therefore, we have to be really good at keeping the mouth clean at home. So that would be all your regular brushing time and flossing, or using the little interdental brushes. But also the dental visits are very important, and not when you get those implants placed is the end of your dental visits. That's actually the beginning of like a long-standing line of dental appointments that has to happen in order for those implants to continue to be healthy and viable and do the function that you want them to do for you. So having addressed now the motivation, regarding, why we want to have our teeth replaced, I think that if the patient has options at keeping their teeth, it's always better to keep your teeth, just because your teeth are natural, right? It's with your own body, and if there's possibilities, I think that you should explore them and see how maybe you might be able to afford it, or maybe split it, do it in a gradient, and being involved in your treatment, and especially on the maintenance, is going to be very important. Maybe start developing habits that maybe before we didn't have, maybe it wasn't explained to us the way that is explained to us now, and starting developing those habits now can actually change the prognosis of your teeth. Maybe teeth that can be like really at the verge of being extracted, now we're changing our habits, we spend more time on them, and they start being more stable, the tooth starts firming up. There's not a lot any more inflammation around the gums. The decay is being fixed. Now we have a crown on the tooth, and maybe that tooth now is salvageable. So I think that exploring the resources is very important. But sometimes we might come to the point that, look, this is non-salvageable. There's the decay is too deep. The situation, it just got to a point that we just need to think about plan B. And maybe that plan B right now might be the implants. And implants are a great solution for patients that have lost their teeth. And if you had an existing denture that you already have, you've been wearing for years and is not fitting anymore, yeah, you can have implants help. Or if you're at the point that your teeth are not salvageable, then it could be one tooth, could be all your teeth, or it could be maybe several teeth. Either way, definitely implants are an option as well. Now, on thinking about that option, if that option is not available to you at this time, let's say you need a full mouth of implants because it's not affordable, you cannot pay for that treatment. And those treatments usually they go, they run between, I don't know, average, depending on how many implants are placed and how much bone you need to have placed to restore the jaws. It could be like $20,000 to 40,000 per arch, and that's something that that's why you need an evaluation and see. But let's suppose that that's not available to you right now. Well, there's always transitional options that will help you get at least in a better situation right now. Maybe take your teeth, sanitize your mouth, get rid of the infection, because that's going to be very important for you to be healthy. And then maybe having that denture, do just a regular denture for the time being. But that denture later on might be able to get retrofitted into implants. So implants can be placed and hooked up to maybe that same denture, modifying it a little bit, of course, but minimizing a little bit the expense that you're gonna need on a second stage when the implants are placed. And just something, since I mentioned before that I wanna brush again, is about infection. So there's nothing worse than having an active infection in our body. And this is something that you all have resources, as Dr. Google. You can go and research and look at papers that have been published, but there's a lot of cases and live cases and reports, and also a lot of research done and studies published that show how detrimental is the chronic infection, the infection, low-grade infection that stays in your mouth for a long time and is not addressed. That increases some inflammatory factors in all your body. Also, it's going to make you more prone to heart disease, embolisms, pulmonary embolisms, clots that go to your brain, and a lot of other medical conditions. There's a long list. So I think that just eliminating those out of the picture is going to be a great thing for you to be healthy. And there's nothing better than our health. That's the best gift that we can give to ourselves, because we all have many problems, right? But when we all have that bad medical report and we have all a bad medical situation, all the rest of the problems don't matter anymore. We can only think about that. So making sure that we're healthy at all times, that's number one priority, to have a happy life. So have a happy life, be healthy, and we'll see you back again. Thank you.
Thank you, guys. Please don't forget to leave your comments below, and we'll see you next week with Having a Coffee with Dr. Munné. Thank you, Dr. Munné, and have a great day.